My name is Eric Ruby. I'm a urologist. I've been a physician for 26 years. I've been here in Somerset for 21 years. Grew up in Cincinnati, went to high school in Cincinnati, went to undergraduate in the University of Texas in Austin for undergraduate school, and then applied to medical school there in the state of Texas. I went to University of Texas Medical Branch, which is the first medical school west of the Mississippi. It's got a long, outstanding heritage. It's located in Galveston, Texas. It's a great place to go to medical school. Then applied for postgraduate training in urology and was accepted into a residency program in Charleston, South Carolina at the Medical University of South Carolina there. Well, so the motivation to become a physician is probably different for everybody, but there's probably some commonalities as well, and it's never just one particular moment in time where you decide to use or to pursue a career in medicine. For me, I think it started in scouting and first aid and merit badges involving emergency preparedness. I like to do things with my hands and then kind of extrapolate caring for people with the surgical disciplines. So as I went through high school, I also was on the receiving end of medical care. I had scoliosis, so I'd have pretty extensive back surgery as a high school junior, and witnessed the amazing physicians and nurses and caring staff at Cincinnati Children's Hospital, and I think that was the point that my decision was made for sure that that's the career I wanted to pursue. Most physicians are fairly adept at the science disciplines. I was never really artistic or anything, so I did well in school with science and math, and so it was a nice marriage of, well, I can adapt science into helping people, and when you're on the receiving end of healthcare, you really understand how crucial it is and important it is to have somebody that's, you're giving up entire control over your well-being and putting your trust in that individual. And during medical school, we rotate through various rotations during our third year of training, and I just happened to be assigned a month of urology. It comes down to a few basic problems that we see routinely. Those are bladder cancer, bladder problems such as urinary leakage problems. Kidney stones are predominant. We see that around here every single day. Prostate enlargement and prostate problems for men. And then on the cancer spectrum, we see quite a bit of bladder cancer, quite a bit of prostate cancer, occasionally some renal cancer. But those are the nuts and bolts of what we see on a regular basis. Within that context, we have a broad field actually in the urology discipline, such that you can subspecialize into the field of pediatric urology. You can subspecialize into endourology, which is kind of more of the advanced, minimally invasive techniques of surgery. But that was one of the parts of urology that appealed to me, is that it touches on many disciplines in medicine. There's endocrinology, which is the hormonal balances of the body that influences the adrenal gland, but also sexual function. You have sexual medicine, you have kidney stones, you have cancer, and you have renal physiology. So we're surgeons, we're surgical discipline for the urinary tract and reproductive tract, but also it's along the lines of being a surgeon relating to nephrology or the kidney itself. So I find that very stimulating. We have such a broad categories of medicine that we touch on, and I think even a little bit of psychiatry, because a lot of what we deal with in medicine is dealing with a lot of anxiety and concerns and fears, and if you have a pretty good handle on how to be a people person and manage those concerns, you'll do well. I have a very simple philosophy with medicine, and I teach this to the medical students as well, because it's not really hard. You just treat your patients like you would treat a family member. It's as simple as that. And if you can communicate with people and let them know you care, then you're going to stand out and do well.